Do you have one shoulder that has started bugging you for no apparent reason? It just, all of a sudden you notice it's just hurting more and more and you're not quite sure why? And have you noticed in front of the mirror or in pictures that one of your shoulders, that one that's bugging you, is lower than the other? If your shoulder does bug you, stand in front of a mirror for a second. Does it sit lower than the other? Maybe one shirt sleeve's always hanging a little bit differently, or maybe you never really noticed it until someone pointed it out. If that lower shoulder is also the one that aches or clicks or gets really tired or bothers you when you reach overhead, it's something to look at. It's tempting to just think it's only that the shoulder's out of alignment, but be careful with that assumption because our bodies are not perfectly symmetrical. Often your dominant hand, I'm right-handed, that side's lower than the other, and that is totally normal. But if one shoulder sitting lower than the other is the one that hurts, we want to start to question what's going on when you move. And often it's that the shoulder blade is not moving properly. Because the position that you see in the mirror of one shoulder lower may be only one clue of a much larger pattern of what's going on. So today I want to show you why your shoulder blade matters so much to how your arm moves. We'll look at why a lower shoulder isn't necessarily the problem by itself, but it can be a clue. And what happens if that lower shoulder, if the shoulder blade isn't contributing well during the movement of your arm, it can be a problem. And I'll show you a simple experiment to see whether changing the movement of your shoulder blade can change how not only your shoulder feels, but how it rotates in the joint. I'm Dr. Melanie Carlone. I'm a somatic physical therapist. I got a master's and a doctorate in physical therapy with 40 plus years of clinical practice. I have 2 forms of yoga education training, breath and nervous system education. Some people call me the body whisperer because I love working with people who have really not had much success with the conventional approaches, living with chronic pain and bracing, fatigue, stress overload, bodies that have been told nothing's wrong with you. And then I really love looking at it and trying to figure out what is connected, what's going on in the bigger picture. So on this channel, we don't automatically assume the place that looks different or even the place that hurts is the whole problem. The bigger picture is looking at relationships. And today, the relationship between your arm and your shoulder blade is incredibly important because when you lift your arm, the arm bone doesn't do that movement by itself. The whole joint works together and your shoulder blade has to participate too. So let's look at it a little more closely. A lot of us think of the shoulder as somehow being connected to the spine, but it's not. The shoulder is a very interesting joint with a scapula, your collarbone, and the humerus sitting in this joint. So the shoulder is really a coordinated system. The upper arm bone, the humerus, moves, which invites the collarbone to move, and importantly, the shoulder blade has to glide downward as the arm goes up. It has to glide back and around the rib cage. So reach your own arm slowly overhead right now. As your arm goes to rise, very soon you should be able to feel the shoulder blade moving along with it. If it doesn't move, then this bone bumps into this bone, and guess what? The rotator cuff is in there. So you need a stable base for this humerus to move from. Imagine what happens if your arm keeps moving, asking for movement, but your shoulder blade is stuck. Then lifting is not easy on that side, and irritation of the tissue in here happens. So, as you go to lift, if your shoulder blade doesn't rotate, the head of the humerus is not able to travel upwards in the joint as the arm comes up. So that's why moving that shoulder blade is so important, because rotator cuff injuries often happen when the humerus and this bone here called the acromion bang into each other. That's often how the rotator cuff gets irritated, frayed, and torn, not usually from one big movement, but from 10,000 small ones. And if you keep moving that arm, even though the scapula is not gliding and moving very well in the collarbone, then your body's really good at compensating. It finds another way. Maybe you lift your neck. Maybe you pull this down and that upper arm has to work harder in order to lift. Maybe your trunk leans to one side to open up the joint. The movement still happens, but the workload gets redistributed. And your tissue, the body structure, wasn't designed for that job. So the tissue starts to complain. So here's what I want you to hear underneath that. Compensation is not the body failing. It's your body solving a problem with the options that it has available to it. And that is intelligence. That is not a defect. So honoring yourself and being compassionate can make a big difference. The shoulder that hurts may not be the issue of strength or needing to exercise more or work harder. Maybe your shoulder is actually working harder than the other one already because the shoulder blade isn't sharing the job. So this is where I want to stop you from doing something. I see this all the time. People notice a shoulder is lower, their posture's not good, so they pull it up, they hold it up, or someone says stand up straight. So now you pull both shoulders back. Have you ever seen people that walk around, they kind of have chicken arms, they hold their shoulders back there, their chest out, and their blades pinned behind them? It is way too common, and it's painful over time. So don't spend the day, if you notice your shoulders off, with trying to correct it, making yourself look symmetrical, because human bodies have asymmetry. It's natural. Our face is often crooked. Your heart sits on one side, the liver on the other. Your dominant hand's been doing more work for decades. And research has actually found that there are visible differences in shoulder blade movements in people with shoulder pain and visible shoulder blade differences in people without it. So appearance alone does not tell you. I'm much more interested in what happens and what you feel on the inside when you move. So as you go to lift that arm, does the shoulder blade rotate easily, or do you find you bang into it? It feels like it's stuck. Maybe that scapula is staying still while your arm does all the work. Do you notice that your neck tightens when you try to lift? Does the movement feel smooth, or is it pinching? Those questions tell you a lot more than whether your shoulders are lining up perfectly in a mirror. So don't get too taken by that, but pay attention. Sometimes a noticeably lower shoulder is in a shoulder blade that is resting or moving differently than the other side. So you may actually hear the term scapular dyskinesis. That's simply fancy Latin to an alteration in the position or the movement of the shoulder blade. And even that needs some context. It isn't a diagnosis that automatically explains pain. Researchers caution over-interpreting shoulder blade measurements, which we can spend a lot of time as PTs doing, because shoulder blades movements vary considerably from person to person. So don't go diagnosing yourself just because the shoulder's lower, but instead let that asymmetry make you curious. How much available movement do you have? Curiosity and diagnosis are really different states for the nervous system. You can take a diagnosis and say, this is how I am. It narrows you. Curiosity opens you up, and you learn from being more open. So if your shoulder hurts, I want you to ask now, what happens to my shoulder blade when I actually try to use my arm? Does my collarbone move? So let's experiment with it. Sit or stand comfortably and let your arms hang naturally at your side. Don't try to correct your posture. Just let the feet find the floor, find your heel, the ball of the little toe, ball of the big toe, 3 points. Press down in your feet, lengthen to the sky. Okay? Let your breath do what it's already doing. Just take a notice about the breath and just listen. Now slowly raise your arm on the side that bothers you, only as far as comfortable, and just notice. Stop anytime. Don't go into pain. And notice where you begin to feel effort. Is it in the shoulder? Is it in the top? Is it in the neck? Does the shoulder immediately start to move up towards your ear? Just notice. Come back down. Bring it out to the side and lift again. Often it's easier to go forward than the side. And just notice. Okay. Now we're going to move the shoulder blade all around the rib cage. So I want you to shrug both shoulders up to your ears. Keep breathing. Now with them up there, slide them back towards each other. With them up and back, now press them down behind you, like going into your back pocket. Keep them down. Roll them forward to the front pocket, down. And then lift them up in the front and slowly draw them back under your ears and release. You just made a square with your shoulders. Up, back, down, forward, and up. If you can look in a mirror, sometimes it really helps to see what you're doing. Now we're going to go the other way. Raise your shoulders up, glide them forward. Now and forward, glide them down. Now with them down, pull them back behind you in your back pockets. Glide them back up behind you. Slowly forward under the ears and let go. Beautiful. You just moved your shoulder blade all the way around using kind of a square, but all gliding around the rib cage as they're designed to do. And that's huge amounts of sensory information going back through the joint into your nervous system. There's a lot more room in the arm when you do that. Now reach the same arm forward, and as it comes up, imagine the shoulder blade gliding down as the humerus comes up. Feel it. The tip of the shoulder blade going down in the back pocket, the humerus coming up. And just feel the humerus moving and the shoulder blade gliding down. How does that feel? Notice, really pay attention. Try it one more time out to the side. The arms slightly forward and up, and let the shoulder blade move around your ribs back and down. And then rest. Don't overdo it, but just notice. Somewhere in there, your body may have even taken on a deeper breath. Or like a sigh that you didn't plan. Or maybe your shoulders dropped a little bit without you trying to drop them. That's your tell. That's what it feels like when a protective pattern lets down a little bit. Learning to recognize your own tell is really more useful than any technique I could give you. You may also notice no difference, or it may still be painful. You may actually have inflammation or even a tear in there, and that's useful too. Or you may notice that your neck worked less, and maybe the arm feels lighter as it goes up. You can move forward before you feel pinch. Maybe your pinch goes away. So, I'm not trying to prove your shoulder blade is the problem. We're seeing whether paying attention, understanding how it works, and changing the movement changes the experience. And this kind of detective work and understanding how things move help you understand how to move your body differently. So if you like that, actually subscribe to the channel. This is the kind of interesting stuff I love doing. Rather than saying, why does it hurt? Start asking, what is the rest of my body doing around the place that hurts? Because it's all interconnected. And tell me in the comments, what did you notice? Did anything soften? I read them. All right, there's another habit that I want you to notice. How many times have you been told, hold your shoulders back? A lot of people interpret good posture as squeezing shoulder blades together, like you're slumping. So the first thing we do is we squeeze our shoulder blades together. But remember what we just did? Your shoulder blade needs to move for you to have normal motion in your arms. So if you're one of those people that's constantly holding your shoulders back, pinning backwards or pinning down because you think it's good posture, you may actually be taking away one of the important movement options the arm needs. So just try it. Squeeze your shoulder blades together and now try to raise your arms. Try to raise them and just notice. Notice the tension of that and then relax. Now, imagine the shoulder blades gliding back and down around the rib cage as the arms come up, and they probably feel like they're floating up. So you compare it. Your shoulder blade is not supposed to be frozen. It's designed to participate. So holding or correcting posture by pinching your shoulders back actually is expensive to your body. Every hour you spend trying to grip yourself into a shape is an hour your nervous system is spent in vigilance instead of repair. And that accumulates. We call it allostatic load, and it shows up in muscle tone being too high, long before it shows up in a scan, but often eventually it will show up in a scan. So good posture isn't a shape that you hold, it's an orientation that you have, and one of the simplest ones is to find yourself grounded, feeling your feet press down through your feet, lift up through the head, lengthening. Eyes to the horizon, breath free to travel through the rib cage, all the way around the ribs, the shoulder blades gliding on the rib cage. And there's another layer of this, literally. Your shoulder blade is meant to move and glide. It doesn't have a socket, the shoulder blade. It creates a socket for the humerus, but it's held by muscle and fascia on the rib cage. And the rib cage is the road that your shoulder travels on when you lift your arm. So if you're always holding your chest up or pinching backwards, or if you're leaning away from one side to the other, it changes the surface that the shoulder blade moves on. So that's why shoulder problems can be so frustrating. And if you try to just strengthen the muscles around the sore spot, sometimes it helps, but oftentimes it isn't enough. Your shoulder needs strength, but it also needs mobility. It needs stability. And the rib cage underneath benefits not from being rigid, but more mobile and integrated into the motion. That's why yoga can be so helpful. So often they're asking for coordination, not more effort or tension, but coordination. The point is your shoulder does not operate independently from the rest of your body. Nothing operates independently, not in your body, actually not in anything. So here's the question I sit with clinically. Why did that shoulder blade stop participating? Maybe it was an injury. Sometimes it's mechanical like that. There's an old surgery or scarring or a year of holding a baby on one hip or a particular way your desk is or driving all the way a certain way with a steering wheel. But sometimes it's protective. The body learned from pain or an injury that a certain way isn't safe, and so it quietly takes that range off the menu. It didn't ask permission, it just protected you. And it may have been right at that time, which is why I don't want you to force anything into place. You don't override a protector and expect it to trust you. You have to invite it. It's like bringing a scared little animal out from under the bed. You have to show it it's safe. Look, one small range at a time, that motion's available again. The rate of change is often governed by the amount of compassion you show it. Push hard and the system holds tighter. Meet it with curiosity and it'll show you the next layer. Awareness itself is already an intervention in your body. So, you noticing your shoulder blade is not nothing. It's where change actually starts. It is a powerful thing to bring your own light of awareness into your body. So the shoulder that hurts may not be the shoulder that needs to work harder. Maybe the shoulders that's already been working harder because the shoulder blade isn't sharing the job. So come back to that mirror now and just notice. One shoulder lower than the other. Now you have some new options for what that means. And it might mean nothing at all. It might just be that that arm is your dominant and you've used it more in the last 40 years. Or it might be a clue that the shoulder blade on that side isn't fully participating when you reach or you try to lift your arm. And the rest of the shoulder has been quietly compensating, covering the difference for you, and now it's painful. Either way, the story is not my body's crooked, something's broken. The story is my body has been adapting. It's always trying to serve me. It's always trying to help. You're not broken, you're protecting. And a protective pattern is not something to fight. It's something to listen to have compassion for. So safety and awareness first, change second. Because the shoulder doesn't want to be corrected, it wants to be included. And often, when your shoulder blade starts working again, starts sharing the load, reaching and lifting gets easier. Not because you got stronger, but because you got more integrated, more whole. And that's the shift I want for you. Not a shoulder that finally looks right, but a shoulder that feels like it belongs to you again. So if this has helped you, hit the like button, share it with other people maybe who are having shoulder pain, and subscribe if this kind of thinking makes sense to you. And leave me a comment. I read them. Tell me how your shoulder blade did with this. Tell me what you noticed. And remember, regulate before you renovate. You're not broken. You are protecting this beautiful body you've been given. All right. See you guys later.